Hi, I'm Casey Roseman. This is Communication 105, Section 5, and I will be demonstrating how to give a breathing treatment at home for a person who would need respiratory medication. Here is my audience. Breathing right is more than just a normal thing for many people. Lots of times people who have any type of lung problems or pulmonary problems are forced to self-administer medication at home. By correctly administering a breathing treatment at home, a person can decrease the amount of visits to their doctor's office or the emergency room in order to maintain a quality of life. One might ask, how do people with lung diseases receive treatment at home? The first way is by being diagnosed by a doctor. And by that diagnosis, the doctor may listen to breath sounds, do an x-ray, or even further testing in order to assess for any other pulmonary diseases that would be going on. The next is being prescribed medication and a nebulizer. As being a respiratory therapist for over 10 years, I have gained not only book knowledge but life experience and enjoy educating other people about the lungs and the pulmonary system. Respiratory treatments and the disease process is a huge area. I will briefly discuss COPD and a home administration of a breathing treatment. The types of diseases that are given to people are with a handheld nebulizer. COPD, which is chronic obstructive pulmonary disease, such as chronic bronchitis, asthma, bronchiectasis, emphysema, cystic fibrosis, and sometimes pneumonia, can go under the umbrella of COPD. It is considered chronic because the condition is ongoing. It's obstructive because there is something in the airway that is not allowing the airflow in and out of the lungs properly. Pulmonary because of the lung, and D for disease. The medications that are given for people that need breathing treatments are called bronchodilators. Bronchodilators are medications that help the tubes in the lungs go from being a coffee stirrer back to being a straw, as they should be, and that's just an analogy that we sometimes use to explain to patients what is going on inside their lungs at the time that sometimes their chest feels tight, it feels as if they can't get enough air out or in. That is at the time when the lungs or the bronchioles in the lungs are down like a coffee stirrer. Sometimes these medications, which are called albuterol and Atrovent, can be given in different ways, such as meter dose inhalers, which some patients use frequently for fast delivery of the medication. The medications are generally given anywhere between 4 and 8 hours apart. And in order to administer the medication, the following steps must be followed. You must have a nebulizer and a nebulizer kit and a nebulizer machine. The machine is basically just an air compressor that forces the air through a tube into the nebulizer cup in order to deliver the medication. Inside the nebulizer kit, you will find a nebulizer cup, corrugated tubing, a T-piece, a mouthpiece, and tubing. These 5 pieces go together this way. The T-piece, the mouthpiece, the corrugated tubing, and the tubing connects to the nebulizer cup, next connecting to the nebulizer itself. Medications. generally come in a vial like this. The top is taken off of the vial, placed into the nebulizer cup. The nebulizer is then turned on. You should see steam coming out of both ends, and the patient will inhale in and out slowly and deeply until all of the medication is gone. This generally takes about 10 minutes. The expected outcome of the delivery of the medication should be or will be shortness of breath if the patient was experiencing shortness of breath prior to the breathing treatment, improved breath sounds if breath sounds have been assessed prior to the treatment, and generally the patient will say that they feel better or less tightness in the chest. Sometimes there are some side effects to these medications such as nervousness, jitteriness, increased heart rate. Those side effects generally go away within 5 to 10 minutes after having the breathing treatment. The benefits of doing breathing treatments at home can help to maintain a person's quality of life during the disease process, as well as decreasing the amount of visits to the doctor's office and the hospital. It's not only a benefit to the patient, but to the family and all of them that care for them. Thank you for your time. Hopefully that you have learned a little bit more about the breathing treatment and the reasons why they are given to many patients.